Thank you, Madam Chair. I yield.
Thank you very much, Senator Warnock. So, I'm sorry, Senator Ossoff.
We look pretty similar.
There you go.
Yeah.
It's down at that end of the dais, so it's good to see you. So I'm going to ask some questions now. I got a chance to do this. Even before the pandemic, half of all Americans lived in childcare deserts, areas where there simply aren't enough licensed childcare slots to meet family needs. We all know that COVID made this worse, forcing thousands of childcare providers to close their doors. For families, this means excruciating decisions. Do I spend an hour each day driving back and forth 2 towns over because that's the only place where there's an open slot? Do I depend on neighbors or relatives who have their own lives to worry about? Some parents are juggling it all themselves, hoping that the baby doesn't start crying while they're trying to do a job interview or do their work from home. Lack of affordable, high-quality childcare affects every aspect of our economy. And while it got a lot worse during the pandemic, it's been holding our economy back for decades. So, Dr. Stevenson, I was hoping maybe we could go through some of the data on this. What happened to women's workforce participation, say, from the 1970s to the 1990s, through the 1990s?
So between the 1970s and the late 1990s, women's labor force participation grew quite rapidly, going from 43% of women participating in 1970 to a peak of 60% in 1999.
Okay, so let's break this apart into pieces. Okay, so we have this sharply upward slope. Did that trend continue?
So that trend did not continue. In fact, it flattened out, and we saw women's labor force participation growth completely stall out, decline slightly, and then decline a lot in the 2008 recession. Although, as I mentioned previously, we saw a real resurgence in that participation rate starting around 2015.
Okay.
But it's also important to realize that male participation fell much faster than female participation.
So we have women's participation goes up sharply in the 70s, the 80s, and the 90s. It flattens in about 2000. Is that what happened in our peer countries like Canada? Did they see that same pattern of rise and then flattening?
No, in fact, the U.S. really led the world with the rapid rise in the 70s and 80s, and the rest of the world started catching up. And then the rest of the world added more sort of workplace supports for working families. They added workplace flexibility, subsidized high-quality childcare, paid parental leave. We saw female participation continue to rise in other OECD countries, and the result has been that the U.S. went from near the top of OECD countries in terms of female labor force participation to really around the bottom among 22 OECD more developed countries.
All right, so our peer countries kept growing female labor force participation and creating more support for that. More family-friendly policies, more child care support, and so on. The United States did not, and we saw a flattening of women's labor force participation. What did that flattening of women's labor force participation mean for America's GDP?
Well, I think the best way to see that is actually to look and see what did it mean in the 1970s, 1980s, and 1990s. The U.S. pre-pandemic economy was roughly 15% larger than it would have been if women were employed at the same rate and worked the same number of hours that they did in 1970. So then think about, we got 15% more GDP because of the growth in the 70s, 80s, and 90s, and then it stopped. So there are lots of estimates over how much bigger our GDP would have been if in the 2000s and the 2010s, women had continued working. If you go up towards, if you think about us adding the kinds of policies that other OECD countries would have added, some estimates suggest that female labor force participation, which would have been about 6 percentage points higher, If you think about something like that, that's certainly more economic growth than something like tax cuts for corporations have ever generated.
All right. And I understand that McKinsey put out a report in which they put a dollar estimate on what would have happened, how much bigger our economy would have been if female labor force participation had continued. Are you familiar with that report? Do you remember the dollar figure on that?
Yes, I am. McKinsey's taken a look at, first of all, the entire globe and come up with really an enormous estimate. But my understanding is their estimate for the United States is $1.5 trillion increase in GDP if we had had that kind of continued growth in female labor force participation.
And I take it, let me ask, in your expert opinion, if we'd had universal child care, do you think that would have had an impact on women's labor force participation?
I absolutely do. A lot of women literally pay to work. In other words, what they spend on childcare is more than what they're bringing home after taxes. The reason they pay to work is because they know if they lose their foothold in the labor force, they're going to have an even harder time getting it back. But many women look at the idea of paying to work, being away from their children, and bringing home no financial benefits for their family as a result, and think, this isn't a sacrifice I want to make.
I really appreciate this. Without child care, millions of mothers just can't work. And holding these women out of the workforce harms them, it harms their families, but it also harms our whole economy. This is what it means to say that child care is infrastructure. It's part of the basic support we need so that everyone gets an opportunity to work and our economy is productive. This is our moment to act. You raised this point earlier, Ms. Goss-Graves. The president has proposed a major expansion of child care and early childhood education. And when Congress acts on infrastructure, child care is not going to be left behind. So let me ask you, what size federal investment do you believe is needed to provide quality, affordable child care to every family that needs it?
So we think we need an investment of $700 billion. At that level, we can ensure that families don't have to pay more than 7% of their income for child care. At that level, we can ensure that child care providers are actually paid wages that are dignity wages akin to kindergarten teachers. And at that level, we can increase the supply so that we don't have this challenge of the child care deserts that are especially a problem in rural areas, and that there will be more supply in terms of facilities, but actually more workforce supply.
Well, I couldn't agree more. Just yesterday, I sent a letter to congressional leadership with the support of over 100 of my colleagues calling for a $700 billion investment in child care. So let me ask you, Ms. Goss-Graves, some in Congress have argued that we should focus just on roads and bridges and then come back to a discussion about child care later, if ever. What would be the impact on women if we leave child care behind in our infrastructure package?
I just think that we don't have that choice. We cannot live women who have lost so many jobs in this economy, who have held together their families in this economy with work that is both invisible and barely made visible and certainly underpaid in this period. People are counting on Congress to deliver on childcare, and that is a short-term solution, but it is a long-term solution too. It goes to their long-term economic security, their ability to retire with dignity.
Yeah. So I really appreciate your testimony here. I support investing in our roads and bridges and broadband internet. It's all important. But we have to invest in the kind of infrastructure that women need as well. As a young mother, I had a terrible time finding quality, affordable childcare, and twice I nearly quit school. I nearly lost my job because I couldn't manage childcare. If we don't get this done, my granddaughter is going to face the same kind of problem I faced, and that is simply wrong. We can't let that happen. The infrastructure train is leaving the station, and we cannot leave childcare behind. So let me, if I can, I'm going to do a second round of questions here. I want to talk about another aspect of childcare that many of you have raised today, and I appreciate your raising it. We have two very different systems in our country for teaching our little ones. For 5 and 6 year olds, of course, and for older kids, we have public schools. No matter where you live, no matter how much money you make, no matter whether you have a job, you can send your children to public school to learn, and you can do it for free. Now, why did public schools start at the age of 5 or 6? Well, mostly because back then nobody thought that children could learn anything earlier than that. And now, of course, we know that's not true, that early childhood experiences affect whether a child's ready for first grade, but they also affect that child all the way throughout childhood and into adulthood. For example, high-quality early childhood education is linked to better health in adulthood and reduced odds of substance abuse or arrest. Many experts point out that when we spend a nickel on our smallest learners, we save dollars down the line. But for the littlest kids, parents are on their own. Don't have an extra $10,000 or $15,000 a year to send your child to a high-quality early childhood program? Then you get to juggle between friends and relatives, or maybe just leave your job because child care costs more than you can earn. Dr. Stevenson, let me ask you, do these two separate systems make sense, given what the evidence says about the benefits of high-quality early care and high-quality early education for our children?
I believe if we were designing our education system today from scratch, we would absolutely be emphasizing early learning as a critical part of that education system. As you said, we didn't know back when we designed our education system that so much learning happens in the first 5 years. We now know that really does form the foundation upon which people develop and grow. But I really want to tie this back to, in the last century, our economic growth was completely driven by the fact that we educated workers more than any other country in the world. Mm-hmm. We are now not educating our citizens more than any other country in the world. We are behind on early childhood education. We're also behind on universities. And this failure to invest in people, it's ultimately going to hold our economy back.
Yeah. So I think the evidence is clear here that you're citing that high quality care helps all our children learn and grow. That now, in addition to Head Start, we do have a limited public program to help low-income parents get affordable care for their kids, funded primarily through the Child Care Development and Block Grant Program, CCDBG. But our public child care system works very, very differently from our public school system. Ms. Gosgraves, does every single parent qualify for help getting child care regardless of their income or work status under current law?
Oh, I wish that were so. It's really only the lowest income families that qualify. And by a family qualifying, what that means is there are many, many children who would benefit from being in an early childhood program who can't because her parents aren't eligible.
Okay, so not everyone qualifies. Let me ask you about the people who do qualify. If you're eligible for the program, can you just walk into a child care center and sign your child up?
Well, unfortunately, it's also not that easy. There is the work that you have to do to demonstrate that you're eligible, which ends up serving as a barrier for a lot of parents. On top of that, there are waiting lists, and processing all of this can mean that parents and families, they languish on wait lists for months.
You know, we don't make parents prove that they're working or that their income is low enough to be able to send their child to first grade. We don't put those children on waiting lists to get into second grade. We understand that education is beneficial for all kids, so we invest in it as a country. Early care and education should be the same. We need to make it available for all of our babies, regardless of how much money their parents earn or what kind of job they have. You know, we can't lose sight of why this matters. Ms. Ngo, tell me about the children in your program. How do you see them grow and learn when they're with you?
Something. What I want to clarify is like I was misunderstood. When I talk about regulations, the question was, what obstacles were there when you wanted to start your program? And I listed some obstacles that are there. Having regulations in childcare is very, very important. They are the basis of trust. Health and safety are very, very vital in daycare. So I should not be mistaken to say that regulations are not required. They are required, and all we need support to help us implement those regulations. For parents to keep their kid with us, they need to trust us, and regulation build that trust because parents know that their kids are in a safe place. Thank you for that clarification.
Thank you. And yes, go ahead.
Let me now answer your question. The kids I have in my daycare, I have kids in my daycare now that range from the ages of 18 months to 10 years. Those kids in my daycare have different personality. They have different health issues. They are at different level of development. I have kids that are shy. I have kids that are happy. I have kids that somehow struggle with their speech. We call them speech delay. We have kids that are just recovering from the pandemic and they are in a trauma. I have a kid, I will share two stories. One, I have a kid that the mom was pregnant and lost the pregnancy. And when the child was born, apparently the child lived for one day and died. And that child came to daycare, and all I watched the child do was trying to pick toys and make them look sad. A child that used to be a happy child, you see that child struggling with feeling sadness. I have the task, I have the job of recognizing what that child is going through and helping that child to recover, helping that child to deal with sadness. Today, I have a parent in my daycare who is making a little bit over $475 a week. She has 3 kids. The first child is 14, the second is 13, and the last one is 2 years old. That parent doesn't drive. That parent has to push that child in a stroller to my daycare every day, and then go down straight to the bus station to take a bus to go to work. And sometimes you see that parent getting home tired. I am obliged when, like yesterday, it was raining. That parent, there was no way she's going to trek 30 minutes under the rain to come and pick up the child. She had to call me to find out if I can help pick her up from the bus stop. I had to go pick her up from the bus stop. I had to arrange for someone to take her from my daycare to drop her and the baby. Otherwise, they will be wet to their pants under the rain. That parent is just one of the so many different cases we go through on a day-to-day basis. When you ask me as a provider, as a parent, as a business owner, what is the role of childcare? I am submitting that childcare is a public service. Childcare is a public service. Childcare should be prioritized. If we do not prioritize childcare now, we are going to get down into what we call a big disaster later on. Like I earlier on indicated, the job we do is about infrastructure, building the brains of these young kids. If we fail to build these brains correctly, it's about teaching them those small first, we call them magic words. Thank you. No, I'm sorry. Helping them to build their personality, helping them to build character. If we fail to do this, what is going to happen down the line? These kids will be wayward one way or the other. What will it need to fix the situation? If we fail at this level, if we don't have the resources that we need to build our young kids so that by the time they become of age, they have what it takes, character, they have the skills, they can manage their emotions, they can integrate, they have the opportunities to learn and strive and fly like every other child, down the line, we are going to have more problems. What I say is the play they do at daycare, play to me is a factory. It's a factory where the kids learn different things. And that's just what we are doing. I will take 1 more minute to say something.
So we're going to need to keep this short. We're a little over here.
Just the last minute. The one thing that I want us to know is that those kids that I'm watching, if I don't watch those kids, you and some of the senators will not go to work. If I don't sit here, if daycare providers, whether they are family-based, whether they are center-based providers, if they don't do this job, you will not be able to do your own job. Other people will be affected by that. If any morning I get up and say, oh, I'm feeling sick, I cannot work today, 5 parents will not go to work. What is the multiplier effect of those parents not going to work?
So thank you. This is really important, and the work you do is enormously valuable and important. You know, we now have decades of research showing how important these early childhood experiences are, and the children in your care are very lucky to have you. So we've talked about the impact of our underinvestment in childcare on our economy. We've talked about the importance of investing in high-quality early childhood education on our children and long-term on our economy. There's just one more issue I want to talk about before we leave, and we've already alluded to it today, but I want to go back to this again. Our nation for decades has underinvested in childcare, and childcare workers are among those that have been hit hardest by the pandemic. As of this April, the childcare industry had lost more than 150,000 jobs. That's 1 in every 7 jobs in the sector. Women of color have been disproportionately hurt, and many providers are still struggling to get by. As a society, we have not valued this work the way that we should. In 2020, the average pay for a childcare worker was only $12.24. That's at the average. Think about how people can make more money doing the checkout at McDonald's. So here's the first question, and I can ask this one of you, Ms. Go. Do you think that $12 an hour accurately reflects the value of the work you do for children and families? I think there's going to be a one-word answer here.
The answer is no. And
yes.
My no, I want to defend my no, because when you pay me $1, what are you rewarding me for? You are equating what services that are only equals to $12. If doctors do take care of kids and they are paid so much, if teachers, grade 3 teachers, they do take care of kids, they are paid so much, they are building brains. I am handling the most delicate portion of that developmental goal, our children, and you think that I only deserve $12 when the same kid that I bring up to this level, I have done the most difficult job. When I do that job, I pass that child on to middle school, to pre-K school, they are paid more.
Yes, so it's very important work. Let me just ask, can you easily raise your fees so that the hourly wage goes up?
How can we raise our fees easily when the parents are struggling? I just narrated a story of this lady who makes $475 a week with 3 kids. How do I raise my fees to such a parent? When the pandemic hit, most parents were unable to even pay their out-of-pocket family fees. now I had the decision to do what? To cancel out-of-pocket fees, suspended collecting those fees. I had too many things in my mind. If I send away these kids, these parents that I can't watch their kids for free, what will happen when they get subsidies and later on need my program and are able to pay? So my first answer is no, it's not possible to just raise fees.
So you have given us the illustration of how the childcare market is broken. The price of providing high-quality care at fair wages is so high that many parents are simply priced out of the market. Childcare providers can't offer more slots because they're worried that parents can't pay, which in turn creates more shortages. So can I just ask you, Dr. Stevenson, this looks like a market that's broken. I'm going to ask you to wrap up here. What should we be thinking about to make this market work better?
The market is broken, and it's broken because parents cannot be paying for the investments that need to happen when their children are young. These are things that should be paid for over a lifetime. And that's exactly what our policymakers, what our system is set up to do, which is to have Congress fund these investments in children, to have our government fund K through 12, to have our government fund early childhood education and childcare. And then our children will grow up to be able to be more productive, to earn more, to allow us to produce more. And that will actually make it so that we could raise more in revenue, more than enough to cover the cost of this. So it's incredibly important that we provide that subsidy and we take that burden off of parents who desperately want to see their children invested in.
Well, thank you, Dr. Stevenson, and thank you all who've been here today. I think you're exactly right. We do not ask parents to pay the full cost of first grade for their 6 or 7-year-old, and we should not ask parents to pay the full cost of educating and caring for a 2-year-old either. And this is exactly why I'm fighting for a $700 billion investment in childcare. After parents, childcare providers are some of children's most important teachers. We need to transform our childcare system to recognize the skill and the value of care workers. Expanding quality care would mean that providers can offer fair pay and benefits, and it would make it easier for families to be able to find quality care. You know, we have this opportunity. This is our moment. We are rebuilding America's infrastructure, and a core part of that is making sure that we make the investment in our next generation, in our children. We do that, and that lets mothers go back to work and fathers go back to work now. That helps our economy, and it helps our youngest Americans. We have to make sure that when we rebuild infrastructure in this country, that we create good middle-class jobs and that childcare providers are not left behind. So I want to thank all of our witnesses who are here today. I appreciate your providing testimony. For any senators who wish to submit questions for the record, those questions are due 1 week from today. That's Wednesday, June 30th. For our witnesses, you have 45 days to respond to any questions. And again, thank you all. I appreciate your being here. We have a chance to do something important. Thank you. This hearing is adjourned.